Hello and welcome back to Vicky's case. This is Dr. Jerry Cuomo here in my private office. We are now cleaning up the cement residues, and of course it's going to look a little bloody in here, only because this case was, like I said before, it's presented as a veneer case with a severe problem. So much attention had to be placed not only on the preparation but also under the gum tissue so that we could facilitate a perfect result for Vicky. She presented with fairly large dark triangles, and in order to treat that area you have to go below the gum line a little bit. So we preserve the soft tissue by placing Siltrax cord, which is a cotton cord, and now we're going in to remove the excess cement. Even with all that we've done trying to remove cement in the soft phase, now here comes the tough part. So slowly but surely we're going to remove each one of the 6 cotton cords. You can see me picking at that now. That is just a braided cotton cord, probably the size of fishing line, like a 15-pound braided fishing line, but it's actually made of cotton, very specifically made to allow that cement, which is very clear, by the way, to adhere to, and acting as a barrier so that cement doesn't go too far below the gum line and cause problems later on and bleeding problems later on. So we want an end result here to be cement free from any margin and also from any root surface. And how important that is when a patient comes back for a cleaning. I'm sure every dentist has had some cement caught somewhere where the hygienist is right there to clean off any residual cement. So we might book this patient a week later to go ahead and have her teeth cleaned and have the hygienist check for any more residual cement. So most of it's done meticulously at chairside. Now you're seeing kind of mess on the lingual surface where we're polishing with a soft braided rubber, I want to say bullet shaped. Now we're using a fine carbide, very fine fluted carbide. These are your aesthetic burrs or ET burrs, and you're cleaning around the gum line. Again, being very meticulous. The dental assistant is blowing air while I'm polishing the gum line, so we're able to see if we missed any cement. So this comes off very gently in between the teeth, and again, when you're dealing with a subgingival case, you have to be very meticulous about removing the cement. Certainly if we did this case either at the gum line or above the gum line, it would be a much easier case to clean up almost effortlessly. But this is where we get we earn our salary, so to speak, because it is not an easy job. Placing veneers is easy, but the cleanup is the difficult part of the procedure. So let's see if I can discuss anything further. I'm being very careful not to nick any of the soft tissue using the dental microscope here. So that's important. You don't want to start hurting the soft tissue anyway. So using lots of copious water with the tip of the burr. Make sure that these are fairly new. Sometimes we'll use an instrument, starts to wear a little bit, but we like it because it's not as sharp and can also help us in that regard. Here I think you want to go ahead and use a more of a newer tip on the end of that. Of course, everything is sterilized, so I say it's not new. It doesn't mean it's not sterilized. It is sterilized. It's just that in any artist's field, you like the feel of an instrument, and sometimes as dentists we like favorite instruments, and this is one of mine. It's a color code red ET finishing burr, finishing carbide. You can get that from Brasseler Corporation, or you can also there are other brands that are out there. Neo There's another company, Microcopy is the name of the company itself. You can pick them up there. You can start to see how we're cleaning up Vicky's case. Getting right to it. We do have in our office video eyewear, maybe not so much to watch the video recording of a case, but great to use if you want to have a look at your own teeth. A very simple process of wearing the video eyewear. We hook ours right into the line, so that when we record, the patient's actually visualizing everything that we do at the same time. Or even when we're not recording, if they want to just watch either the treatment or watch a movie. They may come in with a video movie that they like, and they'll pop that in while we're cleaning, because they didn't want to really get too caught up into what's going on here. So, they might have a pair of headset on that we supply, and they can bring their own video, or we can play one for them. This is a very slow process, meticulously coming in. I make sure that I use these are actually curettes and Gracie curettes used in hygiene, and they're great for cleaning excess of cement in between the teeth. So again, I'm just giving you short video clips of how we do it here in the office. Certainly you all have your own techniques. Now there's that red color-coded ET burr again I like to use and go in between the teeth. And technique is, it goes without saying, the more meticulous you are, the better the outcome. I can tell you I've seen other cases in my practice from other dentists, and not to put any dentist down, but you can start to see cement lines over time that start to stain, and maybe that might have been one of the steps that could have been overlooked. And going in between the teeth far enough with your preparation, making sure you wrap the veneer all the way into the in between the teeth to allow the visual to remain constant over the life of the veneers, so that you don't see a cement line. Right now, I can tell you that cases look the same, from 1 year to the next, and that's the best compliment that you can have from a patient, is when they come through hygiene and they don't notice any changes occurring. So we invite certainly those individuals out there who are very happy with their cases, or if they're not happy with their cases, feel free to comment. YouTube is a great way to communicate, and I think today more than ever we have the ability to see things visually with the click of a button, and which keeps me going with making videos. I enjoy it, and I think it's a fun process of communicating with both dentists and patients out there. The public needs to know what dentists go through. It's not an easy job, and we try to make our jobs easier every day, but to get to this level of care, a lot of work has to be done, and so maybe this might open the minds of those individuals out there when they do want to go through a case. Now we're checking the patient's bite, making sure that Vic has a good bite, and I'm using a real fine diamond to do that with. It's a lot easier, less vibration for the patient, so an ultra fine diamond, shape of a football, and we're just going to spot in her bite tooth by tooth until we're finished. There's a lot more to this, but I can't cover everything on the tape. I do have a few photographs I want to finish with, and we're going to finish with Victoria's before and after smile photographs, and then I'm going to show you her head shots so that you can see what Victoria actually looks like when you see her before we started treatment and after. So I'm going to end this video, it's the last of 4, on Vicky's case, which is a dental laminate veneer case done in my office, and enjoy these photos that are coming up. They're Here's these photos that are coming up. They're shows that initial smile that we started with on the first video. Crooked teeth, discolorations, spaces in between, and here's her after. Beautifully. Now we cover a smile that jumps out at you. She looks very confident and comfortable with her smile. She loves to show off her teeth now. Before she actually smiled with less initiative. So here she is, headshot in the chair, and showing her smile, and then we'll show you her after. Amazing results here for Vicky, and here she is, all made up as well, and just very confident in her smile. This is Dr. Jerry Cuomo. It was just a great pleasure to bring this video to you, and I hope that we hear from a few of you out there, and take care. We'll see you on the next video series.